So what can you do to reduce your risk of getting or spreading bloodborne pathogens and infectious diseases? Well, first of all, following the standard precautions. Much like universal precautions, which includes identifying blood and a few body fluids as having the potential of containing bloodborne pathogens, standard precautions means treating all blood and body fluids, non-intact skin like abrasions, pimples, or open sores, and mucous membranes like the insides of your eyes, mouth, nose, as if they could carry bloodborne pathogens and infectious disease. Standard precautions are the minimum infection prevention practices that apply to all patient care. This includes safe injection practices, safe handling of potentially contaminated equipment or surfaces in the patient environment, and respiratory or cough etiquette. The key is to eliminate the exposure to all blood, bodily fluids, and other potentially infectious materials. Standard precautions includes the use of hand washing and appropriate personal protective equipment such as gloves, gowns, masks, whenever exposure to patients' body fluids is anticipated. Wearing gloves does not eliminate the necessity for hand washing. Hand washing is the single most effective way to prevent infection. Hands should be washed before and after patient contact. Wash hands during patient care as hands become soiled. Wash your hands with soap and water or use an alcohol-based hand rub immediately after removing gloves. Now remember, hand washing isn't the kind of hand washing we might do when we're in a hurry. We're talking about deliberate hand washing for at least 10 to 15 seconds. So follow your employer's exposure control plan. This is a written plan the employer must prepare to eliminate or minimize occupational exposures. Every workplace must have an easily accessible copy of its exposure control plan. The bloodborne pathogens exposure control plan must include a determination of employee exposure by job classification, the implementation of various methods of exposure control, including universal or standard precautions, engineering and work practice controls, and personal protective equipment. Not to mention information on the hepatitis B vaccination, communication of hazards to employees and training requirements, record keeping, procedures for evaluating circumstances surrounding exposure incidences, post-exposure evaluation and follow-up, and implementation methods for these elements. Anyone can write their own exposure control plan, but if you find that you need help with this, make sure to check out our website to see if our exposure control plan is just the right fit for you. You know, the fundamental method of protecting yourself against bloodborne pathogens and infection is in controlling the hazards. This can be easily accomplished by several things. Elimination. Get rid of the hazard or the hazardous tasks whenever possible. Substitution. By replacing a hazard or hazardous task with safer equipment or methods. We call those work practice controls. Engineering controls, the use of devices such as self-sheathing needles and sharps containers to block or eliminate that sharp risk. Personal protective equipment, otherwise known as PPE, use it, know where your PPE is, and how to use it properly. And then lastly, as I mentioned before, work practice controls and administrative controls, following the policies and the correct procedures in order to eliminate and reduce the risk.